Hi, my name is Helen, and welcome to Yellow Chair Collective, the podcast. In this episode, I sit down with Jen Gold, a therapist specializing in eating disorders, to discuss the challenges of body image and disordered eating during the holidays. We explore societal pressures, the impact of family dynamics, and practical tools to foster a healthier mindset. Jen shares powerful insights on recovery, mindfulness, and how small steps can lead to big changes. Before we dive in, I want to spotlight our nonprofit, Entwine. Entwine is our sister nonprofit organization providing affordable therapy services. Entwine's mission is to make mental health support accessible to all, and we're currently accepting donations to continue this vital work. Your generosity helps bring healing to those in need. So you can check out the link in the description to support. Now let's get into the episode.
Right.
Awesome.
Cool.
So Jen, welcome to the Yellow Chair podcast. How are you?
Thank you. I'm good. How are you doing?
I'm doing pretty well. I'm trying to set a goal of walking more often. It's like a mindfulness practice. I don't know what it is, but I think that sometimes I was playing pickleball the other day, and my pickleball partner was telling me that I was more anxious as a player than I should be. And so I've been trying to get more into like mindfulness based practices. So walking, I feel like, is the exercise that's been helping me. But yeah, I'm doing good. It's a long-winded way of saying I'm
That's
good.
great.
Yeah.
Great. Good practice.
Yeah. Do you have any practices that kind of keep you yourself?
Yeah, no, I also love to go for walks. I do yoga, and then sometimes I do a Pilates class as well. And I really notice a difference in how I feel, and especially in how I sleep.
Mm.
If I don't do those things, it makes a big difference. And then another thing is I've been doing lately both yoga and Pilates with a friend.
Mm.
And that's like a double whammy of like fun exercise, sociable. It's really nice.
It's always nice to do it with a partner. I've been doing it a lot with my boyfriend, and so going to do yoga, walking, it's just like better with people, I think. So much better than
It really
It's
is.
also crazy to think that COVID was 5 years ago and how isolated we all felt, even for us therapists. So, yeah.
Definitely. Yeah.
Yeah.
We talk about that a lot, like how glad we are that we can like be in the same room. And
Yeah, we don't have to wear masks. It's just a different feeling when you can see someone's whole face and whole body without any barrier in between. I just don't think
so
we were
different.
created
Yeah.
that way. But topic at hand. So, for those of you that don't know, Jen Gold is actually a therapist at Yellow Chair Collective. And the reason why I asked her audience to be on the show is because Jen actually has experience working with folks with eating disorders. And Jen also teaches at USC, the University of Southern California. But Jen, I don't want to talk for you. I'd love for you to introduce yourself and talk about how you got into this type of work.
Yeah, I mean, really, I did sort of just fall into it. It was one of the first jobs that I had when I finished my master's degree. And I started working there partially just because I loved the director of the program that I worked with so much. And I still actually consult with her pretty regularly when I have a client with an eating disorder because she's so knowledgeable. And I really enjoyed that work. And I really, I felt like it got into a lot of clinical issues that I was really interested in. And yeah, I liked working with those clients. And I think that it's, I feel in graduate school, a lot of what I learned was like, oh, eating disorders are really frightening and they are frightening. It's one of the most dangerous clinical diagnoses that a client can have. But I think it's also true that treatment really does work and recovery is possible and even likely over time. So yeah, so I really enjoy that work, and I've enjoyed the other clinicians that I've met. And one thing that I actually really like about it is the way that it almost has to be like a treatment team focus, or it's easiest when you can really recruit other professionals to work with you. So obviously, if somebody is in like an IOP or PHP, then you already sort of have that, or residential, right? You already have that treatment team around you. But you can also create it if you're working with somebody on an outpatient basis, like refer somebody to work with a dietitian or work with a nutritionist, to work with a psychiatrist or some other type of medical medical doctor, and really get a team of people around you so that you feel, and that speaks to the question of it feeling really frightening, to feel like, okay, I'm not the only person who knows that this is going on. And there are other people supporting the client and also supporting me professionally in the work. So those are some things that I really enjoy about working with this population.
Yeah, I do want to kind of talk about a couple of distinctions because before we started recording, you told me that there's a difference between having body image issues and having disordered eating. And so before we dive into the topic at hand, which is like body image and how it relates to the effect and disordered eating that folks may have in the holidays, I just want to break down definitions here and have people get to the root of how an eating disorder is developed. But before I get into that, like, what is the difference between body image issues and disordered eating?
So, I mean, I would think that like a lot of people could have, I guess by body image issues, we mean like maybe dissatisfaction with the way that their body
Mm,
looks. And I think lots of people have that experience. I think that's a pretty common experience for people to have. Um, but certainly not everybody who has dissatisfaction with their body also has disordered eating, if that makes sense, right? Like lots of people might not like the way that their body looks, but not really have any issues around food and just think like, you know, I don't love a part of my body, or I wish that it was different, or it used to be different, or, it should be different, or something like that. And I guess that might be considered an issue. Um, but, it doesn't interfere with their life, and it doesn't interfere with
yeah.
their ability to enjoy food, etc.
Yeah. I first learned about disordered eating in my first year as a clinician. We had a person with a PhD who specialized in disordered eating give us a training, and it was really illuminating from a therapist perspective, but also from a woman's perspective. I didn't understand how so much of the marketing messaging that we were being given was actually disordered eating, like labeling food, labeling what French fries are. Is it good or bad? Is salad is good? Fried foods are bad. Like it, I didn't know that. And it was almost placated to me growing up in the early 2000s and even in the mid 2000s as being a healthy eater. And I guess I'd love for you to break down like how does someone develop an eating disorder? And as a therapist, I think we both know that it doesn't always have to do with food. Sometimes it can have a lot to do with control, but I'd love for you to break down from your experience what that looks like and how that's developed.
I think there are probably as many pathways to developing an eating disorder as there are, people who have them.
Yeah.
Um, but definitely, I think what you're talking about sort of stewing in our culture that gives you the idea that some foods are good, some foods are bad, that some foods are healthy, some foods are not healthy. And also just even the idea that like health should be our highest priority at all times.
Mm,
Um, all of those ideas, I think, taken to an extreme, can nudge someone to the direction of having an eating disorder. And I would think about an eating disorder as being like, I mean, there are the DSM criteria, but in general, similar to other disorders that we work with, I would think about the impact on your life.
mm,
Are you able to live the life that you want to live? And if you're not, because of your engagement with food, your body, your weight, your shape, your appearance, if you're not because of those issues, then in general, you probably have something approaching an eating disorder. And then especially, there can get to be like the really physical criteria where like, you're at risk of your heart stopping because not eating enough food impacts all of the muscles in your body, and your heart is a muscle, right? So that's very extreme, obviously. But I think what you're talking about is that also like we all just sort of imbibe the message that, good people eat good food.
mm,
Good people take care of themselves in a certain way, like good people strive to look a certain way, and that's an indication that of their value in some way.
mm.
And I think that is just a message that we get. You just get it for your entire life, and like you were saying, like you don't even really question it. You just sort of think like some foods are good, some foods are bad, when in fact. I think it is a tenet of like intuitive eating, and I think of eating disorder treatment in general, that food is just food. There's no good food, there's no bad food, there's just food, and you can think about it all as just fuel and giving you energy. So one idea of how to work with, I think that's like that idea like flies in the face of a lot of messages that we get
Yeah.
about like, no, but you should be healthy. And one way of thinking about it is to think, instead of imagining that food is inherently good or bad, is to think more about like, well, what's its impact on me, And like, how do I feel if I eat that food? And one of the things that that will lead a lot of people into disordered eating is restricting. And restricting can also be seen as good, right?
Mm.
Like, I'm on a diet. Like, even your medical doctor might tell you you should go on a diet. But I think there's also a lot of research to suggest that dieting doesn't work,
Mm.
right? That in fact dieting can really be harmful to your metabolism, and people can really go, most people who go on diets and lose weight end up gaining it back plus a little bit more.
Mm.
So as they do that over the course of their life, they can end up, their weight can go up and up and up. And then doctors tell them, like, you need to get a hold of your weight. People can be actually starving, like not eating, in a famine state, hardly eating any food, and be overweight, according to their doctors, quote unquote, overweight. So the idea that restricting will lead you to lose weight over the long term isn't true. And in fact, what restricting does is it makes you really hungry.
Yeah.
And when you're really hungry, guess what? Food tastes amazing, right?
Yes.
And you don't have to restrict that much or that long or that intensively to really start thinking about food quite a lot, and to really have food be like, to really get sort of obsessed with it and have that be one of the major things that you think about over the course of your day. And I think, like you were sort of saying, like, that might be reinforced by the messages that we get around us, that you're thinking about eating well, that there's nothing wrong with that. And again, like, maybe there is nothing wrong with it for people. Like, I'm not going to say everybody who's trying to eat in a way that, like, we get the message that is healthy for us. Not all of those people have, say, orthorexia, which isn't an official diagnosis, but whatever, that they're too obsessed with it. I don't know. I don't know the impact on their life, obviously, but for some people, that can really be a road to developing an eating disorder towards, because the way it often begins is that people will really restrict. And if you restrict, it's pretty, it's just logical and reasonable and pretty predictable that eventually you will start to binge
Mm.
because you're so hungry, and your basic survival just sort of takes over at that point. When you have access, you give yourself access to food, that you will binge, and then that you'll feel very ashamed.
Mm.
And then some people get into behaviors to try to compensate for having eaten what they consider to be too much.
Mm.
And another thing is that when you're not getting enough energy, you're not taking in enough energy to function well within your body. Your brain is part of your body. So it's really easy also to get into some very distorted thinking. And I think can be a real link to body image issues, and to not being able to perceive what you look like very accurately, and to having a distorted sense of how you appear to yourself, both to yourself and to other people. So that can be part of the cycle for a lot of people in
Yeah.
developing an eating disorder.
So I'm hearing you
And
say,
so treatment really looks like you have to start eating. Like, that's
yeah.
the basis of, that's number one, is you have to start eating normally.
Mm.
And a lot of times the reason that people have need more support and end up in, like, a more supportive environment is just for that simple fact that you need to eat, and you need to eat several times a day, and you need to do it for the rest of your life.
Mm-hmm.
So if you haven't been eating, your hunger cues also get very messed up. Your hunger and fullness cues very quickly become, your body decides, like, well, if there's no food available, then I'm not going to waste precious energy telling you that you're hungry,
Mm.
because there's no food to be had here. So, when people with disordered eating say, like, I'm not hungry, or, I have pain, they don't know how to interpret, and their body doesn't know how to give cues, because your body, it's almost as if, like, your body's kind of given up on you, like you've broken the trust.
Yeah.
So your body doesn't bother to tell you that you're hungry, and you don't really know that you're full. So it can take several weeks or months for people's hunger cues to come back.
Wow.
Yeah, so that's a huge part of eating disorder treatment, is just support to help you eat, and to help you figure out, with the help of dietitians and nutritionists, how much food do you need, how much energy do you need at each meal and each snack per day,
Mm.
to get to a healthy place. And some people gain weight and some people don't.
Yeah.
It just, it's, so our idea of, like, calories in, calories out, if you exercise this much, you'll lose, all of
Right.
that is not actually, doesn't seem to be the way that people's bodies actually function.
Yeah, I'm hearing you say a lot of different things that I just want to dive into, but I didn't know that if you didn't listen to your body's hunger cues, your body stops giving you the cues altogether.
Yeah.
And then I didn't, well, I kind of knew based on like blood tests that I've taken, whether or not I'm actually feeding myself well. So everyone go visit your doctor, which is a side note. But there's another thing that you mentioned about orthorexia. And for those of you that don't know what that is, it's this obsession with healthy eating. It's an unofficial diagnosis, but I think the more that culture adapts and changes, I think the different evolutions of eating disorders starts to take place. And it really does affect your ability to think well. Like it can lead to brain fog, a lot of irritability, I can imagine, when you don't eat, and just a negative view overall in life. But I'd love to go into the body image challenges during the holidays. And so, how do the holidays impact eating disorder and body image concerns for folks that may have eating disorders?
Yeah, I think the holidays can be tough, right, for lots of people, right? And partially, I think it's just because of all the shoulds that go along with this time of
Yeah.
year, right? Like, you should have a house that looks a certain way, have a family or a friend group that looks a certain way. You should feel like celebrating. You should enjoy being around these people, and a lot of those things just aren't true for people,
Yeah.
for many people. And then, on top of not enjoying those things, you also feel bad because you're supposed to be. So that's like, you have feelings about your feelings,
Yeah.
and then
We
then
all
you get
do.
in a whole mess.
Yeah.
Yeah. And the other thing I think with holidays is that often it means you're going home and maybe going to see people that you haven't seen for a little while. And if your body has changed during that time, whether it's in a way that you like or a way that you don't like, having people make comments about it can feel not good. It can
Mm,
make people feel like, even when people think that um, they're happy about, say, like a weight loss, sometimes it doesn't land well when people say, oh, like you look great, even if it's well intended, it cannot land well because it can end up making people feel like, oh, is that the most important thing about me, or is that really what people were noticing about me, or did you not like the way that I looked before?
mm,
So that can be really difficult. Another thing about holidays, I think, is that there is just so much focus on food.
yeah.
And so that can end up feeling like a really complicated thing. And you might be hearing comments from people like kind of what we were talking about, like along the lines of like, oh, I don't eat carbs, or,
Mm,
my pants don't fit, I can't have any more, just whatever types of comments people might make, I'm so fat. Like, even if they're not commenting about you directly, if they're making that type of comment and you're already struggling with that issue, then it can end up feeling like, oh my gosh, is that what I should think? Or is that what they're thinking about me? Or what if I do want to eat a little bit more? Are they watching me? Do they think that I'm doing something wrong? Those types of things.
mm,
So I think all of those things can be complicated in the holidays. And also, so many traditions are centered around food, right? And then
yeah.
that can end up feeling like,
I did have a question as someone that has worked with folks with eating disorders and has trained under a director who specializes in said treatment. How has eating disorders or the understanding of it changed since you started?
I don't know that the understanding of it has changed, but I think for me, when I first started working in eating disorders, I had the idea, which I think a lot of people have, and I'm not saying that this isn't right or this isn't a piece of it, but I think a lot of people think that that eating disorders are an issue of control,
Mm,
and maybe that's a part of it. Certainly, wanting to control like your weight shape diet is a piece of it, but I actually think of it as being more um, about feelings and
mm,
about wanting a way of managing difficult feelings at bottom, that's more of what's going on. And I think it just becomes over determined. It becomes like, here's a way that I can feel good. And again, I think a lot of it is because it is reinforced that, like I said at the start, like, good people eat good food, good people look a certain way, good people are pretty,
mm,
good people are thin, and it becomes very conflated that, like, people who look this way and have a certain weight and shape then also have a good life,
mm,
so that if I'm doing all of those things and people can see that I'm doing them, and they can see that I'm doing them by the way that I'm eating and the way that I'm exercising and the way that I'm taking care of myself, then I'm doing well and I can feel good about myself, and I don't have to worry about my sadness or my anger or my disappointment or my frustration, because I'm working it all out through my behaviors around food
yeah.
in a way. So that's sort of like, I think people in eating disorder treatment have maybe long thought of it that way. I wasn't taught that, like, when I was in school, but I think that that's true. I think it's quite similar, really, to other types of addictive behavior.
Yeah. I'm curious about if there are any client stories that stick out for you. Is in the early parts of your career, in the later stages.
Let's see. I'm trying to think, like, I don't want to say anything like to,
Yeah. Maybe
to
you can
betray
maybe
confidentiality.
you can talk about how you've grown as an individual or as a therapist working with this population. Yeah.
Definitely. Yeah. I think, I think as with, any clientele, I think it has just built my sense of empathy.
Mm,
And also like of how much people struggle, right? And of how hard it is, how difficult it is. I think that, from the outside, and this is not true, right? Like people of all races, ethnicities, etc., and of course gender, right? It isn't only a female thing. But I think there's a stereotype that, like, oh, this is a thing that like
women
rich
go
white girls
through.
have, and that, yeah, and that like they could just eat, and like what's the big deal.
Mm,
And I can understand that impulse to think like, what is the hard part about this, right? Like, you have to eat, you have to eat. But then when you meet people who are in it, I really think as you're speaking with them, and I think this is the case with any clientele, that it builds your empathy and it builds your compassion, and you really find yourself in a state of like, wow, you're really in a tough spot.
mm,
You are really in a hard place. And I think that's a good place to be as a clinician, right? When you can really understand your clients, and you feel inspired to keep working on it until you do understand them. Like when you don't understand something, or you find yourself feeling reactive or frustrated, to instead try to dig into your own sense of curiosity.
yeah.
And I think, like, when you do that, it's always rewarded, because people's behavior, I think by and large, their behavior makes sense,
Yeah.
right? Even when it's not what they would, like, people with eating disorders are often extremely ambivalent. Like they want to get better, but they're afraid. They're afraid of making changes. And I like, that's just such a human
Mm,
experience, right? Like that's so normal. And it's so, I find it compelling. Like, I just find it so like, ugh,
mm, yeah.
haven't we all been there?
Yeah, it's something that I think is so common in our culture to focus on body image. I mean, we both live in Southern California, so I feel like the messaging here is a lot more pertinent than other places across the country. But one thing that I want to go into is the effect that family might have in our view of body image. And so, what role do family gatherings and conversations play in shaping our view of our body image during the holidays?
So I think, like, one thing is, that, and I actually can talk a little bit about client stories here, is that, like, a lot of people have come by their ideas about body image and about the way that they look really honestly. Like, they've been told either explicitly or implicitly by family members, like, this is okay, this is not okay. And, I like this about you, I don't like that about you. You look good when you're this weight, sometimes even to that degree of specificity. Um, and then that can be really hard to go back to a family where that's been the message, and also be told, like, you should enjoy this time,
Mm,
spent with people who have given you, messages that are really hard to hear, and that feel really undermining of your sense of self, and your sense of like okayness in the world. I think it's tricky. And then another thing is that, like, when families become aware that something is off with someone's eating, even if it's like very loving and very well meant, to have people, there can be a feeling of like, oh my gosh, they're watching me.
mm,
Everybody's checking to see, am I eating enough? Am I eating too much? Like, am I doing the right thing? And that can feel like very, even if it's met kindly, that can feel sort of off putting, and can feel like, oh my gosh, I'm really being stared at. And that can trigger shame. And then all of those feelings actually just make it more likely that people will engage in disordered eating behaviors, because that's what they tend to do with all types of feelings. Like, it becomes like, I have a feeling, I will do this. I
mm.
will, I will restrict. It just becomes like kind of a go-to. Um, so yeah, it can be it can be pretty painful, and especially over holidays.
Yeah, and I think from Asian American culture, from my experience, there's almost this like implicit communication of what body image should look like for an Asian American woman, speaking from personal perspective. And it comes in like different messaging. I remember I was working at a coffee shop in college, and there was a girl who was recovering from her disordered eating, actually, funny enough. And she caught herself commenting on my body image. And I didn't even perceive myself as quote unquote thin or small, but her idea of what a body shape should be really affected the way that I saw myself. And there, even that small example can display how different comments, even passing by, can really affect someone's mentality around how they think about their body. And it's almost like this question of, okay, how do I maintain this physique? What do I need to do? How can I control different perceptions about me? And to your point, it sounds like different people restrict for different reasons, depending on what their motivation is. Um, and even in family gatherings, I'm curious about restriction when you said that it comes out of a need of um, dealing with complicated feelings. Is it just about themselves, or does it have to do with the greater world, all of it? Curious about what you meant by that.
Yeah, I think it can be about lots of it can be about lots of things about like I need to look a certain way, you know, to make the people around me happy,
Mm,
to look good, to look in, you know, to look a way that other people will validate. Or lots of people will say, well, I just like it better. Like I just like the way that I look better.
mm,
So it's very personal. It's personal to me. It's not anybody else. But I do wonder, like you were saying, like did you like really like do you really think that's just your idea?
mm,
And I'm not at all saying like it doesn't make any sense. I actually think it makes a lot of sense. And I think our desire to be liked by other people and to be accepted by other people is like the most normal thing in the world, and it completely makes sense. And like it, I mean, you know, fashions make sense, right? Like we want to show that we fit in and that we
yeah.
have our spot and that we're a member of the team, right? That's super normal. But like as you were saying, like it can also become a little bit insidious, and we can find ourselves like doing things that maybe in the long run are not that good for us or that we don't even really like, just to
Mm,
try to have that sense that we can belong and that we can fit in. And maybe we don't even really realize like where those messages are coming from,
mm,
or that like that they're sort of sneaking in, maybe without us really wanting them, you know, without us even believing them.
right.
Like you're just sort of you're told this, you think that it's true, and then you realize, wait a minute, like do I even is that even a value that I hold? Like does that feel right for me? Does that even feel important to me?
Mm. Yeah, we don't really take the
Is that not
time to ask ourselves whether or not we would like to subscribe to that messaging. It's more so when you're taught to see things from the male gaze or even from another person's gaze, you then start to adapt yourself from that sense. So it sounds like
yeah.
sometimes it,
You almost
yeah, go ahead.
I was just gonna say like you almost objectify yourself.
Yeah.
You see yourself as, you know, as something to be looked at.
Mm, that's so sad. It makes me actually empathetic to your point of how different people develop almost like a misattunement from their own bodies. And so, as a clarifying question, after you get a disordered eating client to begin eating and to start working with nutritionists and dietitians, are these the sort of conversations that you have with them around their emotional states and feelings, like where it's coming from, how it originated, etc.?
Absolutely, yeah, and especially around thinking about like, um, you know, as with a lot of diagnoses, to think about like, well, what are your values,
Mm,
and to really consider like, what are your values, and like, can you see them in your behavior, like on a day to day basis, like, are you acting in accordance with your values, and how much of your time and energy are you spending on things like weight, shape, and appearance, and is that what you want your life to be about? Because people with eating are often spending an inordinate amount of time thinking about their weight, shape, and appearance. It's like it becomes a huge part of their lives. And again, like it's because you're hungry,
mm,
and your body so your body is your brain will be thinking about food all the time when you're hungry. I don't know if you've had that
yeah,
experience.
I've had that
But you
experience.
know, when you're hungry, like yeah, it's a survival thing, right? Like your brain is like, I need energy to keep going here, so find some food. So
Yeah.
you think about it a lot, and then it will become intertwined with thinking about what you look like. Um,
Mm,
so yeah, so a big piece of recovery from eating disorders is thinking about, you know, what do I want my life to mean, and what else is important in my life, and what is waiting for me on the other side if I can get through this. Because another thing that disordered eating brings up is secrecy and shame,
Mm,
because nobody wants to talk to other people about the fact that they have an eating disorder,
mm,
because you're not supposed to have to, it's not supposed to be hard to be thin and beautiful in our culture. It's supposed to be easy, right? You're supposed to eat whatever you want and not think about food, and just like, I just woke up like this,
yeah,
right? Like, it's
yes.
easy. So when you're ashamed of things and things are secret,
Mm-hmm.
it's hard to be close to people
Mm-hmm.
because they don't know the reality of who you are. And that's what makes you close to people, is when you really know them.
So it's almost like
So
eating disorders, from what you're sharing with me, creates distance between an individual and that other person. Why is that?
I think it's the shame,
Mm,
and it's the fact that you can't be real. The fact that you can't, it feels impossible to tell somebody like, this is what's going on for me. So it can be really helpful in treatment to have supportive people around who,
mm,
even if they don't understand, like they don't understand why it's difficult, are willing to hear, like, okay, here's how you can support your person. Here's what you can do that would be helpful. Here are things, please don't say. Like,
mm,
it doesn't land the way that you think it lands. It doesn't come off the way that you mean, so don't say it. Don't bring it up. And here are things that would be helpful to say. And here are ways that you can support your person in their treatment goals, like in regular eating, in getting enough rest,
mm.
in treating themselves gently, like incorporating maybe some gentle physical movement that isn't just compensatory. That isn't, the goal isn't just to burn off 600 calories because that's what I ate, right? So and also to help them like take a more compassionate view of themselves,
Yeah,
a more accurate view of who they are. So reflect back to them that it isn't that important to them, to you, what they look like or how much they weigh.
that's so good.
Because when you think about about people that you love,
Mm,
I don't usually people don't usually say, like, it's not their first thing, like, oh, she's so thin,
mm.
right? Like, if I ask people about their best friend, they usually will say, like, you know, things they really love about
Your
their best friend,
eulogy.
right? Like,
Yes. Yes.
yes, exactly. A perspective, right? Like,
Mm-hmm.
or even like when you're old, when you look back, like, what do you want? What do you want your life to have been about? Like,
Mm.
is it really, like, Jen really wanted to have a flat tummy?
That was her only motivation
No,
in her life.
right? No, that's not what I want. So,
That's
like,
so
what do I
good.
want? And then, like, what would that look like? And so often I feel like what people want is what we were talking about earlier, is to feel connected.
Yeah.
And that's why they're engaging in these behaviors, because they think that it will make it possible. Like, if I looked a certain way, I would be loved.
Mm. It reminds me of David Brooks's book, from the book Second Mountain. He talks about resume virtues versus eulogy virtues. And I had never heard it spoken in that way. I just finished reading the book, but essentially what he says is, so many people think of life from a resume virtue. What opportunities can I take advantage of now in the present moment to get ahead in life? Whereas he kind of flips the messaging and he says, why don't we start making eulogy virtues? What experiences allow you to develop better connection with other people? And it makes so much sense to me now why there's so much shame between someone who is struggling with an eating disorder and connecting with other folks, because food is a large part of connection. And when we weaponize it,
Absolutely.
it becomes a huge disconnect for someone that may not understand.
Absolutely. Yeah. And it becomes a hard place to gather together.
Yeah.
Yeah.
Mm.
Yeah,
I
absolutely. Yeah. So
yeah.
thinking about, like, yeah, as you said, like, those sort of eulogy virtues can be a huge part of motivating people
Mm.
to want to do something different, because it's really hard. Like, this is a very difficult change to make, right? Like, any change is hard,
Yes.
but this is a really, you can't, like, say if you're in recovery from like drugs or alcohol, then you can just avoid that thing. But you can't avoid food, and you have to
Sadly.
do it for the rest of your life, many times a day.
Mhm.
The good thing is that then you have lots of chances to practice, and to practice something new and just develop a new habit.
It's a great way to think about it, seeing food as a form of practice. I know we only have less than 10 minutes left, so I want to ask one more thing. And this goes into what we talked about earlier about the pervasive messages with diet culture and holiday media. Um, this new concept that's coming out in culture, new year, new you, new year, new body. usually statistically the increased rate of gym memberships skyrocket. And it doesn't just affect women, to your point, it affects every gender, every culture, especially in American society, what a body should look like. I don't know if you've heard of this trend, Jen. It comes out every December. It's called Disappear for 6 months and then come back when you become someone else. Did you hear about this? This is so unhealthy. It's called Disappear for 6 months and then come back. That's what every YouTube video that comes out on self development is saying. And it's like, I wanted to talk to you about this because I think it's becoming a holiday message. And it's so toxic because it's imbued with the holidays, which is be around people that you love. And I wanted your take on that. Like, initial reaction, I can assume you're shocked, but hearing you talk about
It
this.
just sounds bananas to me.
Yeah.
So like the idea is like you disappear and you go off and like
You
what,
get
like lose a bunch
ripped,
of weight.
you read a ton of books, you become a better version of you, and then the goal is that more people would like you. Isn't that eating disorder 101? Like it's starting to
Yeah.
sound like that to me now.
Yeah, yeah, no, definitely. Yeah, I think I mean an eating disorder, it's like very specific. Yeah, if you look a certain way, if you have a certain weight, shape, and appearance, then you'll get all the good things. But yeah, you'll be essentially it's that you will be lovable.
Yeah.
Yeah, that I mean, yeah, that sounds bananas to me. Like
Yeah, as a therapist
leave
and as a
leave everyone you
person.
care about, leave your community.
Leave everyone, isolate yourself, and then take care of yourself alone in a silo. But with all of this messaging, this episode is going to get published the second week of December 2024. And for someone that is listening to this and going, okay, how do I like combat these negative messagings and live a healthier lifestyle? What do you suggest?
Yeah, so it's so hard. So I think first of all, like a first thing is just recognizing
Mm.
like where these messages are coming from. I do have a book recommendation if people are into reading or listening to books. It's called The Fuck It Diet by Carolyn Doonan, and it talks about a lot of the things that we've been talking about. Um, so that's one thing. And so yeah, so just realizing like, oh, this is what's happening, and when you're hearing things that are distorted or that are encouraging you in unhealthy directions, to just recognize that it's happening. I think that can be fantastic. To find a community of people that think the same can also be really wonderful. To open up to people, like we had talked about, like when people are making comments like that you don't appreciate,
Mm.
if it's somebody that you care about and that you want to be in relationship with, I think it can be really helpful to let them know, like, I know you mean that well, but like I'm really struggling with that. And like if you want to know more, I'm happy to tell you if that's true. So to bring people in and let them know, like I'm trying to do something different. Like, what do you think about this? Like,
Mm.
do you have these thoughts? Do you have these worries? Like, do you want to try it with me?
Yeah.
Right? Create your own team of people that have a different sense of things. And also I think be vigilant about the messages that you are letting in, right? Because we can't control everything.
Right.
Like sometimes like our eyes are just open and things are just coming in.
Yes.
But like if you're taking in a lot of content that you realize doesn't make you feel well,
Mm.
you might want to rethink it, right? And look for messages that are more aligned with overall how you want to live and what you think is really important, like what you really value.
Mm.
So I think there are a lot of people now who recognize how pernicious the ideas around diet culture are, but it's very skewed, right? At the same time, we also have like the exact opposite, right? And like, Ozempic is a whole new thing, right? Like I don't know, are we going back to
Yes.
like, the heroin chic of the 90s? I don't know. Maybe that's what's going to happen, but
It's ridiculous. It's almost
yeah.
like it's being branded as the cheat code to losing a ton of weight. And
Yeah.
it's pervasive, I think, in so much of culture. But before I let you go, we have a growing number of women ages 31 to 50 actually in our podcast listening. And some of our top episodes have to do with parenting boundaries. And so, with that topic at hand, do you have any advices for moms who might want to change their own perceptions around body image and eating disordered thinking during the holidays? Like, how can you begin to
Yeah,
just,
no, I think that's
yeah,
really
go ahead.
Yeah, to do something better for their kids.
Yes, yes.
Yeah, well, first of all, I think that intention is so beautiful and
Yeah,
lovely to try to, right, to try to pass on something different for children.
yeah.
Um, and yeah, I think that that can really look like being aware of the comments that you make about your own body
Mm,
and what you say about food in front of your children, and also what you actually do, because children notice if you're saying one thing but you're doing another. They'll definitely notice. So I think to try to send children messages around food, like, if I think it's true, if you also think it's true, that there's no good food, there's no bad
yeah.
food. There's so and to let kids know, like, all food is okay. These are the foods that we have available. um, for myself, I think I read a book called Child of Mine that I thought was really good
Child of
about
mine.
child nutrition. I can't remember the name of the author, but she really emphasized, like, an idea that I think, like, even my husband thought this was crazy, but that having dessert doesn't depend on eating your dinner. That
Good.
your job as a parent is to give your child the food, and it's their job to eat it.
Mm,
And the more of a thing you make out of it, the worse it will be. So instead, just keep presenting the food that you would like them to eat. Don't If they don't like it, give them, have at least one thing on the table that they like at every meal. And you don't have to make lots of comments about whether they do or don't eat it. Like, try to detoxify it, make it just like
mm,
not something that you have a lot of emotional investment in. And I think, like, when it comes to talking about bodies, you might think about talking about, instead of the way that they look, about how they feel and what they can do for us. And, like, what it's like to feel strong in your
mm,
body, what it's like to feel like you have mastered something, what it's like to be able to do the things that you want to do, even if those things seem like very simple. Like, one thing about raising kids is you get to see their development, and you see, like, oh, it's so amazing. You can do that now. You didn't used to be able to do that. That's your body at work. How amazing. Like, how amazing that your body can run and walk and climb and all of the things, or whatever it is that bodies are able to do. So to talk about it in those terms, instead of about, like, what you look like,
mm,
and how you feel, and also to call out when you see messages that you disagree with,
mm,
or that you think are sort of insidious, or not your values, to just say, like, I don't think that's true.
yeah.
I actually don't believe that. And you can ask your kids what they think. Do you think that's true? Do you think it's true that the most important thing about a person is what they look like? I don't believe that. I think,
Mm.
of course, like, and as I'm saying that, like, of course, I think,
There's a level
like,
of
I wear
grooming that's
makeup.
important. Like
Right. I take,
obviously, yeah, if you smell
yeah.
at work, people are not going to want to be around you.
That won't go well. Yeah. But so maybe what we're saying is, like, a middle path, right?
Yeah.
Like, a message of a middle path, and trying to find that way with your
That's
kids.
so true. I'm actually really grateful for I follow Dr. Peter Attia and Dr. Andrew Huberman on YouTube. And Peter Attia wrote a book called Outlive, and it's all about this concept of health span versus lifespan. He said that we're so focused on optics of how long someone lived that we never think about the quality of life. And he goes into the importance of eating healthy, and what that looks like, that you need to eat frequent meals in order to build muscle, how the food that you intake actually affects your energy level, that even if someone looks the part doesn't mean that they're necessarily healthy based on how they're treating their body. And Dr. Andrew Huberman is a Stanford neuroscientist that goes into brain science and how, like, oftentimes we have no understanding of how the absence of food and its association to physical appearance really does play a deterioration in our ability to function as human beings. So these are all so good, Jen.
Absolutely. Yeah. And, somebody, like, that idea of, like, somebody that looks the part, you're assuming that they feel the part,
Mm,
but they really may not. And I think that's,
that's
like,
good.
that's something we talk about with clients a lot. Like, if you went around and you talked to the people that you think are skinny and beautiful, do you really think that they're going to tell you that they have a life with no problems, and that they feel like they belong everywhere and they're accepted everywhere? Like, it's just not
Mm,
true. That doesn't really exist for anyone. So I think better to focus your life on creating the relationships that you want to have,
right.
which is a lot easier to do if you don't have to be worrying about your food and your weight and your shape and appearance
That's so good.
like 90% of the day.
Jen, thank you so much for coming on. Like, I learned a lot actually, and I'm sure that people listening to this will also learn a lot as well.
Well, it's great to chat.
Yeah.
Thanks for